In this video, we will study about the wound classification system. First, depending upon the depth of the wound, it can be epidermal, that means the wound is located only to the epidermis. Then there can be dermal, and then there is a full thickness wound which involves the epidermis, the dermis, the subcutaneous fat, and the muscle. Next, we have on the basis of contamination, first is the class 1 or the clean wound. Next is the classification of wound based on contamination. It can be clean contaminated, it can be contaminated, and it can be dirty. Now, clean wound is a wound in which there is no entry into the gastrointestinal or the genitourinary or the respiratory tract. These are small or large uninfected wounds. There is no gross contamination and no foreign body. Then is the clean contaminated wound in which there is the entry into the tract, but there is no gross spillage or there is no evidence of infection. In contaminated wound, there is entry into the tracts as well as there is gross spillage. Lastly, there is dirty wound in which there is entry into the tract. Also, there is presence of large amount of foreign body, contamination. Now, examples of all these wounds are very important. Clean wound, it can just be an incised wound. Clean contaminated wound is the wound that is due to elective appendicectomy. Contaminated wound is the elective appendicectomy, but there is appendicular abscess in it. That means there is inflammation present. And dirty wound example can be extensively contaminated traumatic wounds. The third classification of wound is based on etiology, which can be surgical, which can be due to a bite, and it can also be due to trauma. Now, due to trauma, there can be different types of wounds. Like there is abrasions, there is lacerations, there is degloving, avulsions, and crush. Okay, so you can remember it by the mnemonic LADAC, L-A-D-A-C. L for laceration, A for abrasion, D for degloving, A for aversion, and C for crush. That is LADAC. Now, the fourth type of wound based on etiology is the burns. Then there is cold injury, and then there is blast. तो burn मतलब गरम, गरम के साथ ठंडा होगा, that is cold injury. Then there is blast, there is trauma. Blast और trauma एक जैसा है. And B के साथ blast बोलो तो B के साथ bite भी बोल दो. And obviously, if the etiology is coming, you have to say about the surgery, because surgical wound is the most common type of wound that you can see. Next, based on the duration of the wound. This can be acute wound, this can be chronic wound. In chronic, there can be diabetic ulcers, venous ulcers, arterial ulcers, or pressure ulcers. Now, on the basis of complexity, there can be simple, complex, and complicated. In complex, there is significant soft tissue loss, open fractures and visceral involvement is there. And in complicated, you have infections, necrosis, hematoma, and compartment syndrome. Lastly, there are these three types of wound, that is primary, secondary, and tertiary. Here you can see that primary is a very clean and precise wound. The secondary wound has some granulation tissue in it, and there is suspicion of infection and giving away of sutures. And in the tertiary wound, the wound that is initially left open, but when the conditions are favorable, you close it. So primary, you just clean the wound. In secondary, you keep the wound open. And in tertiary, you keep the wound open, but when there is favorable condition, you close it. Now, primary wound example is an incisional wound. The primary wounds can be traumatic or surgically induced. But the wound is closed and the margins of the wound are approximated surgically, leading to minimal scarring, and there is good healing. In secondary, there is no sutures applied to the wound margins. And this, how does it heal then? It heals by granulation tissue. And lastly, you have the tertiary wound. First, you keep the wound open, and after favorable conditions come, you close the wound. This is all about the types of wound.